get started. And Michael just started the recording, so we should be good to go. Okay. All right. So once again, welcome everyone. If you haven't already done so, once again, if you could please consider filling out the pre-seminar survey. We have the QR code there as well, and I'll see if perhaps one of my colleagues could see if they could perhaps drop the link in the chat as well for people to access throughout the presentation if they would like. So then we can get started. Okay. So we are in the 2023 to 2024 Mini Med School Lecture Series. So last weekend, on Saturday as well, my colleague Michael presented on the new Canadian alcohol use guidelines. And then what we're here for today is the presentation on accessing a family doctor in BC. So following this, if you enjoy this talk or you're interested in any of the following talks, we've got the schedule outlined there. So we've got some presentations in the new year on skin conditions and concerns, depression in the elderly, Ozempic and other GLP-1 agonists, as well as a presentation on artificial intelligence in healthcare. So what are we going to be talking about today? Is once again accessing a family doctor in BC. So the way this presentation is going to go is first going to talk a little bit about some background information, as well as the current need for family doctors within BC. And then following this, I'm going to talk a bit about some current interventions that are being done to help aid the need for family doctors in BC. And following, I'm going to talk about a few of the future interventions that are either being proposed or are already in place for the future to help deal with this need as well. So a little bit of an outline for the timeline for today. So we started at around 9 and we're going to be going until 10:30. So there will be a time for a 10-minute break in between. If you need to stretch your legs or anything, feel free to do so during that time. And we will have a 15-minute question and answer period at the end. So feel free, if you have any questions throughout this presentation, you can drop them in the chat, and my colleagues can either potentially answer them at the time, or we will leave them to the end and I can answer them in the question and answer period. So a little bit about who we are. So my name's Derek. I'm a second-year med student at UBC, and I'm joined here today in the chat by Michael, who's also a second-year med student at UBC, as well as by our supervisor, Dr. Gair, who will also be in the chat today. So with all this being said, given that we're still just second-year med students, we are not doctors currently. So if there are any specific healthcare or medicine-related questions, please direct those to your healthcare professional. So these sessions overall and what we'll be doing today is more of a general overview of the topic. Perhaps some of you might have a little bit more information or knowledge in some of these areas. But yeah, we're really just trying to give a general overview. And as I mentioned earlier, the session is being recorded currently. So once again, if you would not like your face or video to be recorded, please turn your cameras off at this time. Okay, so then before we begin here, I would like to acknowledge that I'm joining you from the UBC Vancouver campus, which is situated within the traditional, ancestral, and unceded territory of the Musqueam. Okay, and then back to the outline for today. So like I mentioned before, we're going to start with some background and current need for family doctors in BC. So at the moment, as many of you I'm sure are aware, there is a shortage situation for family doctors within BC. So to give you a bit more information on this, so in a 2019 study by Stat Canada, it was reported that 17.7% of British Columbians aged 12 and older are without a regular healthcare provider. And this number is actually up from the national average of 14.5%. And it's also important to know that BC specifically has the greatest shortage in terms of medical school spots, as well as family practice residency spots. And a little bit more about what I mean for that. We have some numbers for you on the screen there. So basically, in the country, BC has the highest population per medical student spot. So BC has 18,470 people per medical student spot, with the next closest province being Ontario, which has 15,293 people per med student spot. And then similarly for the family practice residency spots, BC has 43,601 people per family practice residency spot. And once again, Ontario is the second closest, with there being 34,340 people per family practice residency spot in their case. And another important thing to note is that within BC, 35.9% of people who have a regular healthcare provider indicate that they can receive same day or next day appointments. And this is lower than the national average. So this indicates that perhaps there is a bit of an extended wait time for medical appointments within BC. So hopefully what that outlines is that it's clear there is a shortage of family doctors within BC. And a few of the reasons for this is, as I mentioned earlier, there are, for the population, too few medical school and family practice residency spots. However, something that's interesting to note is that only one of the family practice residency spots went unfilled in that same 2019 study. So it seems that there is still an interest for medical students to pursue family practice residency within BC. Now, some other reasons for this shortage are also that some family doctors are choosing other paths. So a few things that this could mean is that they may be leaving the field altogether due to things such as physician burnout. And many of the issues that can be associated with this burnout include insufficient wages, as well as extensive administrative work or overhead costs that are being incurred. Some other ways that family doctors may be choosing other paths is choosing more focused areas within medicine instead of the typical longitudinal family physician care. Or they may be doing hospital work, in which case they are not responsible for covering any overhead or operating costs in that case. And another factor is that there is also now an aging and growing population with more chronic and complex health issues. And this can make it difficult for family doctors to spend adequate time with each patient. And another factor that goes along with this aging and growing population is that some of our family physicians are also nearing retirement age, which brings us to our first poll here. So the poll is, I will pull up the poll here in just one second. So the question is, how many Canadian physicians are nearing retirement? So let me just pull up the poll. I think maybe I need to stop screen sharing for just a second, but that's all right. I'll pull up the poll here. So the poll will launch right now. Okay, so hopefully you can all see that. So once again, the question is, how many Canadian physicians are nearing retirement? So our options are 1 in 20, 1 in 18, 1 in 10, 1 in 6, or 1 in 4. Yeah, so if you would all like to participate and lock in your answers there, that would be great. And then we'll see what you guys think. Okay, we'll just wait another 10 seconds or so. We've got some great responses coming in, so thank you all for participating. And then I'll close the poll here in 5 seconds. Okay, and ending the poll. And I'll share the results with all of you. Yeah, so it seems like we've got some mixed responses. So some people are saying 1 in 18, some are saying 1 in 10, and then a few are saying 1 in 6 and 1 in 4. So I'll go back to the presentation here. Okay, and what we can see is that actually at the moment, 1 in 6 Canadian physicians are nearing retirement age. So ultimately, all of these factors, what does all of this lead to? Well, as I touched on a little bit earlier before, it can lead to some longer wait times due to reduced access. And another thing that can come out of that is worse health outcomes. And an additional thing is that many people are, in fact, turning to emergency rooms as their main source of accessing the primary healthcare system, which can be actually very costly to the healthcare system in doing so. So then moving on to some of the things that are currently being done to help aid this issue. So some current interventions. So a main thing that's being done at the moment is helping connect people with the existing family doctors that there are within the province. So the main way that that the province is doing this is through the Health Connect registry. So at this time, I'll just get Michael, if you can drop the link to the Health Connect registry in the chat, and then I'll talk a little bit more about this. So, so basically, you can register online through this registry, through the link that Michael just sent in the chat, or you can do it by calling 811. And either way that you do this, it will help put you on a wait list to be connected to a family physician or a nurse practitioner. So if this is something that you haven't already done, we will give you some time to do this within the 10-minute break. So there's no rush to have to do it now. We will have a break. So if you would like to complete it during that time, if you haven't already done so, feel free to. So basically what they've done recently is that on July 1st of 2023, there's been an expansion of this program. So what this means is that it's now available to everyone everyone within the province, which previously it hadn't been. It was only available within certain areas. And this program's also been expanded in that more coordinators have been added so that on a local level, they can help connect family physicians and nurse practitioners with patients in these local settings. And alongside this, there's also been a new provincial registry that's been added, such that family physicians and nurse practitioners can more easily manage their patient panel and determine when they can accept new patients. And in developing these registries, the province will now have a comprehensive list of those who are looking for a physician, those who already have one, as well as which physicians are able to take on new patients at that time. And starting on November 30th, so just in a few days here, actually, the province will start to report on their progress to connect health practitioners with patients. And they're going to be publishing quarterly reports on this going forward. So we'll be able to see the effects quite soon. Okay, and then this, once you do navigate through the link in the chat, which once again, feel free to do so in the 10-minute break, you'll be greeted by this page here. So then if you would like to register, you can see the blue register button at the bottom of the screen there. So you just click on that. It only takes about 5 minutes. You just need your personal health number, home address, email, and a phone number, and you should be good to go. So In addition, the BC College of Family Physicians actually has a few tips for things that you can try or things that you can do when you're looking for a family doctor. So the first of which is that you can ask your friends or family to introduce you to their family doctor and see if they are taking on any new patients at that time. Also, the next time you go to a walk-in clinic, you can also ask the walk-in family physician there if they're taking on any new patients. And the last thing that the college also mentioned is that you can ask a specialist. So if you go in to see a medical specialist, during your visit, you could ask them if there are any family doctors that they know of who are currently taking on patients. So a major intervention that's going on currently is to increase the number of family doctors within BC, because obviously it's great to connect health practitioners to patients, but we also need enough family doctors there in the first place. So this is something that's being done to help aid this. So specifically, this is being done through a new compensation model that's called the longitudinal family physician payment model. And this was something that was launched on February 1st of 2023. So physicians have been able to opt in to this payment model. And essentially what it allows them to do is to be compensated, excuse me. It allows them to be compensated for increased patient complexity, which is something that I mentioned earlier, as well as the time that they spend with each patient, in addition to allowing compensation for the time that they spend doing charting or other administrative tasks. So all in all, what this results in is an expected remuneration of $385,000 per year. That would be pre-expenses, and this would be for a family physician working full-time. And what that means is they'd be working 41 hours per week, 45 weeks per year, and seeing patients, being in direct patient care for 7 hours of that day. So overall, once you remove operating expenses, this results in an hourly net earnings of $146 per hour. And this is more than 3 times greater than the previous fee-for-service model that most family physicians were working under. And as of recent statistics, roughly 3,300 physicians have already signed on to this model. So that brings me to my next poll. Okay, so the poll is, where would this new compensation model place BC relative to other provinces for family physician compensation? Okay, so once again, I'll just, oh, here we go. I will just open the polls here. Great. So you should all be able to see that now. So where this new payment model, the longitudinal one I just mentioned, place the compensation relative to other provinces. Okay, we've got some good responses coming in. Just wait another 10 seconds or so, and then I will share the results. All right, we'll close the poll in 5 seconds here. Okay. And then I will share the results with all of you. Okay, so as you can see, the majority of you chose that this would put BC above middle in the country, and a few of you were thinking middle in the country or a bit below. So the answer is that this actually puts BC among the highest in the country. So this $385,000 number, puts BC right up there with Alberta. So BC and Alberta are kind of the two highest there in terms of compensation with this new model being used. So hopefully what this can potentially do is help combat doctors leaving BC for other provinces, as previously BC had one of the lowest compensations, average compensations within the country for family doctors. So another current intervention is the New to Practice Incentive Program. So this was established in June 2022, and what this allows is newly graduated family doctors or family doctors without an established patient panel to sign a contract for a maximum of 2 years in which they join an existing group practice in order to build up this patient panel. So off of recent statistics, there's been 157 physicians who have already signed on to this program. And some incentives to doing so, to signing on, would be that it includes an annual earnings of approximately $300,000 per year, in addition to some medical school debt forgiveness. So specifically, this includes $50,000 of med school debt forgiveness, as well as a $20,000 debt forgiveness in following years. And they're also going to receive a $75,000 payment, which can be used towards covering operating or overhead costs. Okay, and another current intervention that's worth mentioning is the the expansion of the pharmacist scope of practice. So in fall of 2022, the pharmacist scope of practice was expanded. So the ministry announced that they were going to do this in part to ease the workload on the family physicians, but this also helps expand the pharmacist scope of care in that it now includes increasing the number of drugs and injections that pharmacists are now able to administer. Moreover, this also allows pharmacists to assess patients and prescribe, excuse me. Yeah, so it allows patients or allows pharmacists to assess for and prescribe for 21 minor ailments. Another thing that was included is this also allows pharmacists to adapt and renew a larger range of medications. And a more recent adaptation to all of this was actually made in January of 2023. And this was where a provincial prescription renewal support service was launched. And essentially what this does is that it provides a support team that pharmacists can contact for help in renewing prescriptions for patients who do not currently have a primary care provider. So that brings me to the next poll here. So after learning about all of these different current interventions, I just wanted to check in with all of you and see how you're feeling about your understanding of these programs. So I'll open the polls once again. Okay, you should all be able to see that. Yeah, so just asking you how you're feeling about your understanding of these programs. Okay, we can see the responses coming in here. So I'll give it another 10 seconds or so. Okay, we'll close the polls here in about 5 seconds. Okay, and closing the polls now. Okay, so it sounds like some of you were aware of these programs, and some of you were not, but you're able to, but you can understand it now, and it's clear. So that's great to hear. And maybe a few of you are still a bit confused. So if you do have any questions, feel free to drop them in the chat, or wait till the Q&A session at the end, and we'll see if we can address those. Okay, so that actually brings us to our 10-minute break. So I will let all of you take a break now. I can stop sharing my, there we go. Yeah, so we can all meet back once again in 10 minutes. So feel free to stretch your legs or anything. And also, once again, we do have the link to the Health Connect registry. So if you would like to register during this time, feel free to do so. And then I will see you all in 10 minutes. Okay, so welcome back, everyone. I hope everyone had a great break and was able to do the Health Connect registry if they wish to do so. Okay, so then we can get started again. Okay, so we've talked a lot about some of the current interventions that are out there for dealing with the family doctor shortage within BC. Now, what are some of the future interventions going forward to deal with this issue? So, the first one that we'll talk about is increasing the number of international medical graduates or IMGs. So the province is expanding the number of international medical graduates or IMGs who can come and practice as family doctors within BC. So they're doing this by expanding the practice ready assessment program to triple its seats from 32 currently to 96 by March 2024. The province is also allowing IMGs to start their accreditation process before they actually move to BC, so that once they do move here, they'll be able to start as soon as possible. And another thing to note is that for some IMGs who may not be eligible for full family practice, they still may qualify for restricted licensure, which would allow them to practice under the supervision of an attending physician. There's also been a bylaw change that will allow doctors from the United States to more readily practice in BC community clinics in the future. So another intervention going forward as well is increasing the number of medical school and residency seats. So over the next 2 years, UBC is expanding both its medical school seats as well as its family practice residency seats. So in terms of medical school seats, there's going to be an additional 40 seats that will be phased in over these next 2 years for a total of 328 seats. That's up from the current total of 288. In addition, there's also going to be an additional 40 new family practice residency seats, which will bring the total up from 174 to 214. And so this is a process that has already actually started. So for this past 2022-2023 admission cycle, there were 18 seats that were added to the UBC Med School. And for the current 2023 to 2024 admission cycle, there will be 22 seats added to that. So another thing that I think is important to note that UBC is in fact the largest family medicine residency program within the country, actually. So that brings me to our next poll. So the question for all of you is, how many medical schools are there in British Columbia? And I will open the poll here. Okay, so yeah, how many med schools are there in BC? Okay, we got a lot of responses coming in. That's great. Just wait a little bit more till we get a few more responses coming in. Okay, I'll close the poll in 10 seconds here. Okay, and then I will close the poll now and share the results. Okay, so some mixed responses here. The majority were saying that there's one med school in in BC. Some other people were saying that there were two or maybe even three. So let's see. So in fact, UBC is the only current medical school within the province. So something that's important to note here and could maybe be a bit confusing is that there are four distributed sites located throughout the province, but these are all run through UBC. So these sites are in Vancouver, Victoria, Prince George, and Kelowna. So there's four different sites, but there is only one medical school that it's ran through, and that is UBC. However, another future intervention is that they are thinking of opening another medical school at Simon Fraser University, or SFU. And so this is something that they've actually, it seems that they've committed to have this open for the entering class, the first entering class to start in September of 2026. So just in a few years here, actually. And so really what the school is aiming is to be focused on family medicine, both through its curriculum as well as through its graduates. So it will also have a dedicated family medicine training program. And this is kind of being modeled after the Queen's University program called the Lake Ridge Health Program, which consists of 20 medical students who are all dedicated and committed to becoming family doctors after they graduate. And this also has a customized curriculum that is based on addressing community needs as well. So we've talked a lot about the current state of family doctors in BC, the current shortage, as well as some current interventions and future interventions. So I just wanted to check in with all of you and see how encouraged or discouraged you may be after hearing all of this. So let me open the poll. And let's see what all of you think. Okay, a number of responses coming in. Okay, we will just wait another 10 seconds. Okay, and then I can end the poll here and share the results. So it seems that the majority of you are feeling encouraged after hearing about all this. Some of you are feeling very encouraged, and then a few are neither encouraged nor discouraged, or feeling a bit discouraged after this. So that sort of brings us to the end of the presentation here, just to give a little bit of a summary about everything that we talked about. So it is clear that there is a current shortage and need for family doctors within BC. Now, some of the things that are being done to help address this currently is the health registry, as well as the new compensation models, being the longitudinal family practice model, the new to practice incentive model, and another current intervention we also mentioned was expanding the scope of practice for pharmacists. And then some future interventions is allowing more international medical graduates to practice in BC, increasing the number of med school and residency seats, as well as potentially, opening another medical school in SFU. So here's all my references. So just to reiterate, you will be getting the slides after the presentation, and this will be recorded as well. So if you want to access any of these references or resources in greater detail, they're there for you, so feel free to do so. And then that brings us to the Q&A portion of the presentation. So I see there's a number of questions in the chat. So what I'll do is just address those first, and then once I get through a few of those, we can open the chat, or we can open the session up to people asking questions if they want to through their mic, or if you want to ask more questions through the chat, feel free to do so. Okay, so the first question that we have is why can't a physician allow several automatic renewals of a prescription instead of having to do a phone meeting to do this? And it seems that this would potentially open up space for more in-person appointments. Yeah, so to answer this a bit, so one of the interventions that I mentioned was the expansion of the scope of practice of pharmacists. So for certain medications, it depends, but for certain medications, there may be renewals or adaptations to prescriptions that can occur through a pharmacist. So not needing to talk directly to the family doctor, but in certain cases, a phone or in-person meeting may be needed with the family doctor if they want to discuss how the medication's going, if they want to adjust doses, or anything like that. Okay, so hopefully I answered that question a bit. So then moving to the next question is, so will the Health Connect registry provide access to a family doctor in order of sign up, or are other criteria applied? Yeah, so I'm not actually sure of the direct criteria that they use to match people, but I do know that yeah, it's sort of based off a lot of factors, I'm sure, and that with this new provincial health registry that they're making, the province can more broadly see and have a comprehensive list for the family doctors who have the availability to take on patients, as well as which people are without family doctors at the moment, and see if they can find a match there. Okay, and another question is that foreign doctors face a lot of barriers to practice here. For example, English tests for British doctors. What is being done to reduce these barriers? Yeah, so I'm not directly sure of sort of the nuances of that. Although I know that they are trying to make it easier and allow more international doctors to practice within BC broadly, but yeah, I'm not 100% sure of the specifics there. I do have a bunch of links on my references page as well, which can perhaps provide a bit better clarity on that one. Okay, and then I think might have had another question in here. Okay. Yeah, so it seems that that's the majority of our questions within the chat at the moment. Yeah, we still got a bunch of time, so feel free, if you have any more questions, if you want to type them in the chat, feel free to do so, or if you'd like to unmute yourself and ask a question as well, either method works. Then I think Michael just provided a little bit more information for the English language proficiency requirements for IMGs as well. Okay, we'll just wait a couple more minutes and see if we've got any more questions flowing in. But if not, now may be a good time, actually. If Michael, if you want to share the post-lecture survey link with everyone. So yeah, if you would like to do so, we do also have a post-lecture survey, sort of just asking you a few questions about your understanding of the topics, and if you feel this session was helpful, and answering any questions you may have prior to heading into the presentation or otherwise. Yeah, so we'll just send that link in the chat there. And then, yeah, if you would like to fill that out, that'd be greatly appreciated, so we can continue to improve the quality of these presentations going forward. And then another question in the chat here is, can you provide any recommended strategies for accessing primary health care whilst without a family doctor? So, yeah, so some of the strategies that I mentioned earlier, just that were from the BC College of Family Doctors, that was sort of more in terms of getting a family doctor. However, if you're still not able to access a family doctor, there are alternative methods that I'm sure many of you are aware of, such as walk-in clinics or urgent and primary care centers as well as nurse practitioners, which can also, that's another thing, I didn't highlight that too much, but through that Health Connect registry, you can be connected to a family doctor or potentially to a nurse practitioner as well. So there is a chance you may be able to, while you may not be able to be connected to a family doctor, you may be able to be connected to a nurse, a nurse practitioner. But if not, there are certain telehealth options such as TELUS Health, as well as urgent and primary care centers as well. Okay, thank you everyone for the questions. Yeah, we'll just wait another minute or so, see if we get any last questions flowing in. Seems like we got one more question that I missed. So the question is, can you find out where you are? Can you find out where you are after registration with the Health Connect more than a year ago? Okay, so I think the question is just asking, can you see, I guess, where you are in terms of the progress of getting connected to, in terms of getting connected to a family doctor by using the Health Connect registry? Yeah, so I'm not 100% sure of checking in with those processes to see how they're going. I'm sure that the Health Connect registry would be in contact with you if they did find a match for you at this time. Also, they do have on the registry, on the HealthLink BC website, they do have a phone number that you can call as well, or you can call 811. So perhaps if you call them, they may be able to give you a better answer to potentially see where you're at in the process. Let me just check through the chat again here. Okay, and another question is, what is the scope of practice for a nurse practitioner? So yeah, that's a tough question. It's also something that's sort of changing as well as the province is looking at expanding the scope of practice for pharmacists. They're also, the scope of practice for nurse practitioners also may be changing. I'll see if we can get if Michael wants to help me out on that. I'll see if we can get a resource for you on that. That would give you sort of that would give you a clear outline on some of their scopes of practice there. Oh, great. And Michael did just send a response for the scope of practice for nurse practitioners. So that will be able to outline it quite clearly for you there as well. Okay, wait another few minutes, see if we have any additional questions. Yeah, okay, so we'll just wait another minute or so, see if any last questions come in. But if not, then we can wrap up the presentation here a bit early, but that's all right. And then, yeah, once again, we do have the post-lecture survey linked in the chat, and it will also be in the follow-up email that I'll be sending to everyone later today. So yeah, if you would like to fill that out, once again, that would be greatly appreciated. And then we will also be sending along these PowerPoint slides, and you also have access to the recording of this presentation as well. So it sounds like no more questions are going to be coming in. So thank you for everyone to coming in and attending today. Thank you for participating in the polls and all of your great questions here. And yeah, thanks everyone for coming in. And if you would like to show up to any of our subsequent talks in the new year, starting in January, there will be information in emails to follow. And once again, if you have any friends or family who you feel would be interested in this sort of talk or any of our topics going forward, feel free to spread the word, and you can pass along the registration forms to sign up to them. Because yeah, we're always looking for more people to come into. So I think we'll end the presentation then. Thanks everyone for coming in. And then, yeah, we will end everything here. And yeah, thanks again for coming in, everyone. Have a good rest of your day.